The objective assessment. The learning objectives for this lecture will be to understand the concept of the objective assessment, to identify the key components of the objective assessment, and to understand the significance of the components of the objective assessment. Finally, to develop the basic skills which are required to complete an objective assessment. What is the objective assessment? It is the physical component of the client assessment to determine which structures or factors are responsible for reproducing their symptoms. It is also used to confirm or reject hypotheses that have been formulated during the subjective assessment under the SIN factors. It requires a flexible analysis of signs and symptoms and a detailed knowledge of relevant anatomy, physiology, pathology and biomechanics, known by Maitland as the permeable brick wall. It allows the fluid transfer of information from theory to clinical application. It will always involve a series of measurable and reproducible tests, which will involve the implication of structures, not merely the indiscriminate application of a series of routine tests. It is important to note at this stage that no single test can be used to implicate one single structure. You may have to formulate your hypothesis around a set of tests. What is the structure of the objective assessment? This objective assessment is normally divided up into two sections. Firstly, and the aim of each section is to assess the different types of structures, to stress structures by mechanical tension or compression. Each test will invariably stress a number of structures and may be common to more than one area of the body. Special tests are normally region and occasionally aim to be structure specific where possible. On the right hand side there is a table. If we briefly go through this table, we'll see what are the components of the objective assessment. Initially there's a moment of observation where the area of the body and around the body is observed. Next there is an assessment of the joint ranges, both active and passive. There is also an assessment of the muscles and tendons, looking at strength, control and length. There may be also need to do some accessory movements pertinent to the joint in question. The special tests, which are normally, as said before, region specific. Some neurological tests, which may involve testing for some neurological impairments, such as sensation changes, weakness, or neural dynamics, known as myotomes, dermatomes, and reflexes. There may also be the need to introduce a functional test to help determine the structures at fault. There may be some contributing factors which need to be assessed as well, such as biomechanics. And finally, palpation of the relevant structures. Let us go through each of those components in turn. The first component of the objective examination is observation. Observation begins as soon as the client walks in. You'll be looking at how they move, their posture, their attitude, any antalgic positions they may adopt, their gait, and how they sit and stand. It's important also to look locally around the area of dysfunction for any abnormalities. This may involve deformity, swelling, discoloration in the form of bruising or hematoma. It is also useful to look regionally for asymmetry in terms of bulk, joint posture and tone. Furthermore, it would be useful to look globally at their posture, and for more information on this facts look at Kendall and Kendall. Finally, relate your findings to the patient's symptoms. On the right hand side of this slide, you'll see various examples of deformities, swelling, postural types and trauma.